Right, so my hip flexors are dodgy, my quads are dodgy, I get anterior knee pain, I get medial knee pain, I have any pain through this area or upper lumbar injuries, this is worth checking. Really, really common that they'll think they have an anterior hip or an impingement-based problem. The test for your femoral nerve is just a prone knee bend. So can you do this and feel just a quad stretch? Because that's what you should feel and that's what is normal. So back pain is abnormal, just like it is on a straight leg race. We look out for cheating of abduction and humping the bed, which is where we go into involuntary hip flexion on the front. So we tighten up ab and adduction, and we can hold that hip to the bed and then roll up and through. On a decently positive femoral nerve test, it might well be here and they get back pain. All right, and that doesn't have to be severe. I've seen that in like cyclists who are planning to, compete next week. Go, ow, that's it, that's my knee pain. So if that's not enough, then we want to be able to wind it up. And just like the practicality of it, the easiest way to do that is to add hip extension. So if I add a little hip extension and bring that knee up into that position there, a lot of people do tend to feel it a wee bit more in their back like that, all right? So I identify which side is tighter on testing. But I don't mind if they're pretty negative. You might just do this for somebody who you suspect might have a lesion there, and the same is true with straight leg raise and traction. Sometimes we're doing it on pretty much painless people. Oh God, yeah, you can see where they previously treated. Yes. So your femoral nerve arises from L1 to 3. So 1, 2, and 3 are our possible targets. But we can happily add one above and one below. So you might feel like you're working on 4 and you might feel like you're working on the bottom of the T-spine. That would be absolutely fine for this stuff. So I'm going to take a positive side. Just compare for me there to there. A little bit worse on that one? Yeah. So we think we've got a lower lumbar problem, but actually she's got a bit of tension on that side as well. So now what I'm going to do, sorry, I'm going to stand this way around, so you might want to loop around, is I'm going to repeat that knee bend and I'm going to palpate the side of the spinous process. Okay, so my hand is, bear with. I'm going to abut the side of the spinous process. So what I want to do is find the tip, slide around the side and shove it sideways. Usually pushing it into a direct rotation is what I'm going to find is helpful. And I'm going to pick my level based on whether I feel any tenderness or movement of the spine as I do the knee bend. So I put my thumb into that position, just into the gutter next to the spinous process. I'm going to bend the knee and see if there's any tension there. None at that one. Come down a level. And that one has a little. So just positive is any feeling of movement of the spinous process as you tension. That shows there's some kind of muscular reaction to the femoral nerve glide. And yeah, surprise, surprise, a bit more around the bottom of it, so 4. So then I've got 2 usual options. So I've identified this segment. It's usually a bit mobile when I bend the knee. It's usually a bit sore when I shove it. And then the real acid test is, can I shove it and they feel less pain? So I'm pushing straight sideways and then I'm going to rebend the knee. If it's right, you will just get this sudden transfer of, oh, that's not in my back now, it's in my leg. That's a good sign. That's what we want to get. Are you okay down there? So that's a nice thing to get, and it could be that they're actually stacked into extension if it's a bit milder, like so. But you can also tension it, weirdly, doesn't feel like it, but it is, with lumbar flexion. Because for some people, that will increase the pull in their back, particularly if it's snagged up high. And then the other reason to put the head of the bed down is that it opens the spine up and it makes it easier for you to feel their spinous process line, and therefore if you're not certain you're finding the right spots, then doing it in flexion will open it and clear it and make it a bit more mobile. So it's this basic idea of pushing sideways and then rebending the knee. If you get no joy from pushing sideways, try pushing up. So on that same vertebrae that didn't feel that quite right, I'm essentially doing a one-sided unilateral mobilization with a bit of a bias up towards the head. So I'm going to try and generally open a segment and then bend up. So I'm either pushing up towards the ear on the same side, or I'm pushing straight sideways through the body as I'm bending the knee. So two really useful techniques, one for the femoral nerve and one for the sciatic nerve.